On.
Thanks so much. Good afternoon, everyone. My name is Terry Clover, and I'm on the board for the Massachusetts Public Health Museum. And I'm really happy and excited to say happy start of Public Health Week to everyone here. We are thrilled that the museum was able to partner with the Tewksbury Public Health Library to deliver this program. We strive to present info that is interesting and relevant for all. So we're really well aware that AI is at the forefront of a lot of people's minds. And fortunately, we have some great speakers here with us tonight that are able to present on how they are using AI in real world public health and emergency management. So first up, we have Maya Harlow. She serves as the health officer and director of the Essex County Office of Public Health Management, leading one of New Jersey's largest local public health systems. She oversees countywide programs in environmental health, emergency preparedness, mobile health services, clinical operations, epidemiology, and intergovernmental coordination across 22 municipalities. She's a master's certified health education specialist and registered environmental health specialist, and holds a master's of science in public health and serves as an adjunct professor teaching public health law, administration, and epidemiology. She's widely recognized for translating policy into effective, accountable public health practice. And then, Maya, I think I'll let you go first and then introduce Chris after, if that works.
Oh, sure, no problem. Would you like me to do the presentation and then go for Chris?
I think that would make sense for flow wise.
Okay, sounds like a plan. So first of all, I hope you guys can see my screen. My name is Maya Harlow. I am beyond excited to be here today. One thing I am going to say to everyone is I am not a tech person. I am a public health person. But one thing I learned during my immersive experience in COVID is that we needed a really good way to stop reacting and to start to emergencies. What we needed to do is to have a really good plan. So when COVID was over, and we all know we all went through it during COVID, I said, what can I do better? What can I do in order to make my response to emergencies better? So I started to do the research, and I came upon the GIS system. So for those of you who may not know what GIS is, a really good way for us who are not tech people to understand what that is. GIS is taking data and creating a picture. And imagine how helpful that would have been to us in the beginning of COVID if we were immediately to start to take data and to start creating pictures with it. If we could create pictures of what a disease outbreak looks like, what resources look like, and what even health disparities look like. If we could start seeing and visualizing these things, it would help us out immensely. So with our county government and our county executive in Essex County, I came to him and said, we need to start to do and invest into our GIS program. So we started out doing a pilot program. The pilot program that we did was with one of our largest municipalities. So just to step back a little bit, the county that I oversee has 800,000 residents. It has 22 municipalities, and it has a wide variety of both urban environments and also very rural environments, and also very different socioeconomic areas. So what we did was we picked a municipality that had over 50,000 individuals in it, the third largest in the county. And we started to look at what that demographic looked like. It has both an urban area and it has also a pretty, rural suburban area that you would take in the middle of, New Jersey, for example. So what we started to do, we decided to see what data we had. So the first thing we started to do, we started to use GIS mapping and to see what lead looked like in this particular municipality. So that was one of our first fortes into this program. So we started to look at lead levels, lead numbers, and why did we even do that? The reason we started to do that was because in the state of New Jersey, the lead programs are situated in our municipal governments and our municipal health departments. Everyone knows that everyone in public health, unfortunately, sometimes is understaffed. This allowed us to see a picture of what lead levels look like and how to gauge information and to make sure that resources that we had as a health department were geared towards schools in the area that had larger lead levels, towards parents that had it, and also to start to make sure that when we started to meet with our administrations and those administrations received dollars for lead remediation, we started to point them into which ways to do and what remediation areas to go move forward. This is exactly the same GIS. We used Esri with our. I'm not picking Esri. It's just the platform that we used, and this allowed us to be able to truly see what the hot spots look like. So over time, our educational nurses went out to these schools and they started to do educational programs for both the parents and also deliver information to the schools and also to the school nurses. What we also did, we decided that we were going to look at hospitals that service these areas and ensure that doctors were also ensuring that they're doing lead testing as well. The County of Essex has a beautiful park system, and what we did was we built out the parks environment. And our next forte is going to start to work with our sheriff's department to look at two different things. One thing is we're going to look at individuals who, or accidents that happen in our reservations. But one of the other things that we're looking at is areas around the reservations that might be causing car accidents due to deer, and trying to change road or pathways in order to reduce those accidents. This might be interesting to Chris, who's going to present to you, but our next part and the next adventure that we took into GIS mapping was using our EMS. In Bloomfield, we have both a volunteer and also a paid EMS. But as we know, EMS services are extraordinarily understaffed. So what we did was for our EMS, we decided that we were going to map out our calls based on time and location. As you can see, those purple boxes simulate calls between 9 p.m. and 12 a.m. Those were the most concentrated calls. This allowed for our EMS to start to target those areas with staffing and those times with staffing to ensure that adequate response and response times were achieved. Next thing that we did, also using the Esri system, we used it for a community dashboard. This is an interactive dashboard that we use to be able to look at various different community health assessment data points. In this particular case, we used data to be able to look at insurance access. And a lot of you are wondering, where is your AI access? Well, let me tell you this. And what did you do with AI? This is all the building blocks of understanding data. In order for us to understand what AI can do, we need to understand the data that we have. Because if you have bad data, you're not going to be able to use the predictive AI or the machine learning in order to achieve results. We also used this data for those of you who are in environmental health. Some of you may know in the state of New Jersey, the counties serve as DEP agents. So those DEP, one of the programs that we service is called our Right to Know program. Most of you may know it. The Right to Know program allows and mandates for industry and public buildings and industrial buildings to have to report what chemicals they hold in their facilities. Unfortunately, we are required to receive surveys from them. Unfortunately, not many people actually hand in their surveys on time. As you can see this particular dashboard, we have 258 facilities that currently have not submitted their surveys. We have 367 that were late. But why does this mapping even matter? Because this mapping matters for emergency response, but this also allows us to work with our local municipalities to be able to assist us in getting these surveys done correctly and on time to be able to secure and make sure that our first responders are safe. And now we are with our machine learning. So the first thing we decided to do is when we pretty much started to understand the data. We sat down with our staff and with my staff, and we decided to see what were the points that we really wanted to understand. So we decided, why not? We dealt with COVID, why not use flu? So the first points that we used was we decided that we were going to map our flu seasons and essentially create a flu season for a municipality. So what we did was we wanted to forecast the amount of influenza cases that were going to be monthly. And we also wanted to make sure and understand the individual ages that were going to be affected. So essentially what we wanted to know is, what is our flu season going to look like, and who are the individuals that are going to be affected by it? So this was our first forecast model. We took the years of 2021 to 2024 and we mapped them. So this was the 2025 season that we did. And so we took if you look at the map, the red map is the predicted cases. The one thing that we saw was obviously something to be expected. And we saw that October and November and December, we were going to start to see peak seasons. And starting in January and February and into March, it started to fall. This was using the GIS data that we saw, and these were the hot spots. What I want to do is I want you to understand why the GIS mapping is so important. When we looked at these hot spots in the township that you've been seeing, what we saw was all those really yellow spots were actually train stations. Isn't that something that would have been amazing for us to see during COVID for respiratory diseases? One thing I want you to understand is that in the state of New Jersey, in order to report a communicable disease, which is where we got this data, came from the Communicable Disease Registry, is, for example, if myself, Maya, who lives in the township of Bloomfield, gets the flu, that's where it gets reported. So all of these individuals live around those areas. So what we started to understand is that individuals who lived around those areas, who lived around train stations, were the ones that were more susceptible to getting the flu. That is because people using those trains go outside. They might use the same Dunkin' Donuts or the same 7-Eleven that you use every single day and on your trip to take your kids to school, whatever that may look like. And what we did with this data, we decided that we were going to go ahead and start to partner with our New Jersey Transit partners and start to create both flu clinics and also advertising in those areas about flu clinics that we were having. And this is one of the things that resulted from it. So back to our AI predictive modeling. One of the things that we saw during our predictive modeling, and one of the major things that we saw, and as you see, that is the red case right here. The first box shows that the predictive learning gave us the concept that the individuals who were most affected with the flu in this particular case were ages 25 to 30. And this was very interesting for us to understand, because when we are taught in public health, we are taught to target young and older individuals for the flu because they're most at risk. But the one thing we don't construct our public health campaigns to individuals who are between the ages of 25 to 30. And those are the individuals that are taking care of our younger children and are taking care of our elderly. So in this particular health department, we decided to start creating campaigns geared towards that 25 to 30-year-old demographic to be able to secure those individuals for getting those flu doses. And this is our 2026 season. It actually was pretty predictive on our end. As you can see, it is now the end of March and it looks like it is absolutely going down. And it predicted quite well that January was quite the month for us. So I wasn't able to put it into this particular presentation, but the comparison that we did with our 25 model to our 26 had us 75% accuracy rate for predicting both age and also predicting location of disease as well. So that was our flu analysis that we did. For those of us who are in local public health, for those of us who work for any public administration, our biggest issue that we usually face and that we get are rodents. We continuously get complaints about neighbors and rodents, and we're seeing them. And so that is the next task that we undertook. We wanted to see how we can get ahead of the program of rodents and try to beat them at their own game. So what we did was, and which was really different than some of the other things that we did, we decided to not only take rodent complaints and where they were, we also decided that during that we're going to start to take temperature, rain, and specific humidity to take into account into our predictive AIs to be able to tell us when these rodents complaints would spike and when that activity would be greatly increased. So, of course, as I stated before, we needed to get our baselines. So it was really interesting to us that sometimes certain things did have. April and August were really our peak months. In the winter, things started to dip, but it was definitely variable for each month. And that has a lot to do with different situations. For example, if there are large construction projects that might be happening during some months, and in some areas, that rodent activity will increase. So when we started to take into account, we started to look at temperature, we started to look at specific humidity. What we started to see is when the temperature was at a 285 Kelvin and a higher specific humidity, those cases started to go up. And here you go, and you see that same GIS mapping that we did in the beginning. We needed to get that baseline to see where those rodent cases were. One of the things that these maps allowed us to see was that, I don't know if you could see it in this particular one, but there's on the lower half of the map, there's a river that runs through those larger clusters, and you'll see it more on the hotspot area. So what we decided to do is, before we even went into our predictive AIs, we decided to work with our DPW and start to bait in those areas before we even decided to look at our machine learning. And then we decided to look at our machine learning. When you started to look at it, so you could see the predicted cases are the ones in yellow. So we had a little bit of a discrepancy because we had an overlap of cases. That's why you do see two lines. But again, as you see, August, September, October, and November, those were the spikes. May and June, it started to go up. So what did we do in order to start to abate the situation? We looked at the locations where our hot spots were, and we started to deploy our inspectors to start to make sure that garbage lids were covered. We started to see that during the months of January, February, March, and April, we were doing extensive checks in certain areas that had those high concentrations. What we started to see is that those complaints started to go down. We actually just received our predictive analysis between 25 and what 25 looked like. We got a 90% accuracy rate as to where they were. So one of the things that we said is that after we started doing all these proactive measures, we were actually able to get rid of a $20,000 pest control contract that we had in certain areas because we were doing these proactive inspections. So that was our rodent program, and that continues. The one thing that we were also able to do was, during the SNAP crisis that occurred, we were able to very, very quickly analyze our SNAP numbers, and also to be able to overlay them with what looked like community fridges, pantries. So we were able to look at the concentrations of SNAP numbers across one of our largest municipalities, and we are able to deploy food resources into those areas. And this is what it looks like on that level. So last but not least, this is the one brand new simulation that we started to do with AI. For those of us who live in certain areas, especially in the Northeast, we're getting a lot more flooding. We're getting a lot more rain activity. So we decided to see and work with our computer gurus to see if we could take the information from a municipality and create an AI in the case of an emergency and a flood simulation for just a particular municipality. And this was really important to us because, as we said, Essex County is extraordinarily diverse. And we needed to see what that would look like for a response situation. And it's really important for us to understand what flooding can do. Flooding can stop activity of businesses. They can cause large amounts of damage with houses. And then also the recovery phase, mold, things of that nature. If it's also in the summer, that can cause mosquito issues if there's too much pooling in those areas. So we wanted to see if, for example, we were expecting a hurricane and we wanted to see if we could predict based on the weather what that would look like. So what I'm going to do for you is this is a live simulation video that is showing 3 hours of rainfall at an intensity of 1 inch. So what you're going to see is you're going to start to see the population of these dark blue spots, which is going to be where the water is pooling. So as you're seeing this populate, this is really important because our first responders can now know where those larger pools are. So the darker that blue is, the darker and the more depth that it has. The one thing that I am going to show you is, for example, another one that is 3 hours at 2 inches an hour, which is definitely heavier rainfall. So you'll see the difference there. And what is really interesting about this particular machine learning AI is these pools and this particular machine AI learning can actually give us what the water depth, the water speed, the flow rate of that water, and also the flow direction. That is imperative for our first responders to be able to understand what they're dealing with. So imagine our first responders for this particular municipality, they can listen to the weather, they can input this into their programming that we have created as a county, and now they can respond. And they can respond in placing resources in areas that they know are not going to be flooded. They can create evacuation routes based on this simulation. They can also create recovery efforts based on this in areas and be able to put resources into areas that really do need it. So again, why is flood data important in public health? That of course it protects our public health professionals, evacuation routes, emergency response, and before flooding. It prevents injuries, especially for those that need to be evacuated. It protects our most vulnerable. And of course, it also protects our pets. But the other thing it does, and I said this in the beginning, I wish that we had the resources to be able to plan and not to be able to react. And that's exactly what each one of these programs are giving us, is the ability to not react, but to plan. And supporting resource planning by guiding where medical supplies and staff and keeping services available during or after a flood are extraordinarily important. So I know that I have about a minute or so to keep going, but I think what I want everyone to understand, and I said this from the beginning, I am absolutely not an IT geek. I am a public health geek. But one thing I want everyone to know is that the future of public health is using this as a tool. This does not replace our public health professionals. This does not replace our first responders. And sometimes this is not even to be a frontward facing or public facing entity. This is a tool to be able to be used by individuals in public health for us to stop reacting and to start planning. And that is the most important thing that I think I've learned through this journey that I've undergone here in Essex County. And I'm truly grateful. And I think our next speaker, Chris, is going to talk exactly about emergency response, which is a perfect segue. So I want to thank every one of you for jumping on this webinar with me, for taking the time to listen to the story of Essex County and to listen to the story of public health. Thank you.
Thank you so much, Maya. That was amazing. And I'm very excited to introduce Chris Kendall, who's the Emergency Management Coordinator for St. Joseph's Health in New Jersey, where he oversees emergency preparedness, incident management, and the hospital emergency response team across multiple campuses. He is actively involved in statewide preparedness initiatives, serving with the New Jersey EMS Task Force and as a medical unit leader with the New Jersey Forest Fire Service Incident Command Team. Christopher frequently speaks on emerging technologies in public safety and healthcare, focusing on the practical applications of artificial intelligence in emergency management, operational planning, and healthcare preparedness. His work centers on bridging technology and real-world response to improve decision-making and resilience in complex healthcare environments. Thanks for joining, Chris.
Thank you very much for having me. And Maya, thank you for the beginning there with everything. You are a great lead into where I'm going to go. So, opposite from Maya, I am not a public health person, as my background suggests. I am the IT geek. That is my forte. That's not my background. My background is mostly in public safety for the last 20 years, mostly in EMS, some structural firefighting, wildland firefighting, as well as dispatch also. I did work for a little bit as a tech company, and that's where I got my integration with AI, and that's where I got familiar with it. Let me pull my screen up here so you guys can see. And we're going to talk a little bit about how this situation works and how I use it. So I'm more focusing on AI in the tech field itself, and then ways we can use it both for preparedness and in emergency response. So before we even get into it, you need to understand the differences when people say AI. There are three main types of AI that people typically refer to. And there's the one that Maya was speaking to the most, which is machine learning. That is what we are all most familiar with. That is your ChatGPTs, your Claudes, all of those normal everyday AI bots that you talk to back and forth. They learn from different information that's inputted to them, and then from there, they're able to make decisions on that data that's provided to them. There's two others that a lot of people don't have a lot of influence with, would be natural language processing, which is actually speaking to AI models, and they're able to translate English language into data and then provide data back in a verbal tone. That is more of like your Siri or your Alexas. They use a form of natural language. Sorry, I had to look at my phone to make sure she didn't turn on when I said that. That is your more natural form of natural language processing. There's more integration with that coming with ChatGPT. Now on the apps, you can actually download and speak to it instead of texting to it and give it different voices and teach it how you'd like that to respond back to you. And then there's computer vision. Computer vision, a lot of us have probably seen before in the past. That's your VR and your AR, your virtual reality and your augmented reality. These are both used quite a bit more often now, especially in training scenarios. And there are some processes out there of it being implemented in emergency response, specifically augmented reality. I can't remember off the top of my head which country it is. I shame myself because I was at their presentation at one of the conferences I went to, and it was amazing. I got to look into it. I will let you all know. But there is a country that has implemented augmented reality into their first responders' glasses. They all wear a version of like Google Glass for their responses, and it actually helps them both chart, document their call at the same time, and it provides live simulations and readings from their devices connected to the system. So if they're on a blood pressure machine, if they're on a pulse oximeter, they're getting those readings both virtually, physically looking at the devices, and then virtually on their software. So even if they look away, they're able to still see it in their augmented reality of what's going on with the patient. And that data is also being captured in their electronic charting software and transmitted to the hospital so that it's reviewed 24/7. A lot of this stuff is going to help with your preparedness mostly, and then your response. There is more and more implementation of AI and response nowadays than there has ever been in the past. we could have this chat a week from now, and I'm sure technology will have even expanded tenfold from where we are today. It's amazing and a little scary at the same time, the way that AI is advancing and the rate it's advancing. It's going to advance well beyond anything. I've been doing this presentation now for probably about 2.5 years, and I have to update it every single time because there's just new information and new stuff coming out every single week, and it's advancing eons beyond when I first did this presentation, what I thought would be possible. So some benefits of AI that people mostly use it for in emergency management, emergency response, and preparedness. The biggest ones are predictive capabilities. By feeding it good data and good information, you can forecast with good predictability potential emergencies and crises that are going to come out of your area. For my hospital system, we do have our own AI hosted on our internal servers that we utilize to process information, and we'll feed it some of our HVAs, or our hazard vulnerability assessments, as well as our after action reports from incidents and trainings that we've done throughout the year to guide us on what might be coming in the next year and where our training is lacking and what we need to focus on. With decision-making processes, this has not been implemented in my organization, but I do know of others that have used it. They're using an AI assistant in their online incident management platforms that correlates to their emergency operations plans, their incident action plans, as well as learned data from previous incidents and exercises from all of their after actions that are correlated together. And during live emergencies, they actually have almost a chat assistant that they can talk to in their incident management system by tagging a person and sending it a message. And within a few seconds, it'll give you a response back of what happened in the past and how we might be able to do it better this time, and what lessons learned from previous expenses you don't want to forget. It's a great thing to be utilized. My biggest thing throughout all of these talks with AI is always going to be never use the final product that AI gives you. I always recommend a human AI human approach if you're going to use any sort of AI within your organizations. And what I mean by that is that you're always going to feed information into the AI, gives you a response back. You're going to review it, and then you're going to feed it back into the AI system for a more clarified approach of differences you want to see. And then that second output that it gives you is going to be your quote unquote 95% final version. And then from there, you're going to go in and make your final doses to it, your final changes. The thought being that AI, no matter how advanced it ever gets, will never replace a person in any way or form. It will never replace human emotion, human examples, human training. I don't care how great it gets, how many data centers we build, it will never get to that point. So I always recommend any output you get from an AI system, put human hands and human brain into it, read it fully, and add your changes and your examples to it, because no matter what, it'll never get perfect. Back to the presentation. Streamline communications. This is something that we are looking to implement currently. So we use a mass notification system at our hospital, as I'm sure most other agencies do, and same with public health. Use it for your correspondence in your area. Utilizing that AI system to generate alerts based upon findings within the hospital. So if certain trigger words are found in patient charts as they're coming in, it'll generate alerts to our infection prevention department, to our emergency management, to our facilities department on different issues that might be coming up because of issues that are being entered in any of our systems, not just our PCR, any of the management systems. It tracks and it correlates and it finds a trend of what might be coming, and it's able to send out alerts or messages through either Teams or a reverse 911 system almost if it's an urgent alert. And utilizing AI to formulate that data and help to get those key points of something may be occurring. We may want to check on this thing before it overrides us or takes us out of commission is something that we want to use it for more in the future. Resource management is a huge one, especially during COVID. I wish AI was as advanced as it is now as for during COVID. It would have helped immensely, at least the organization I worked at the time, with our resource allocation. Like everybody, I'm sure we ran out of PPE. It was hard to keep track of your staff, knowing when to place your orders, what the timeline looks like for the orders to come in, and then that expanding window of the further we got into COVID, the longer out it was till we got those supplies in. Utilizing AI, you could have been able to look at what your current stockpile, what your burn rate is, and then based upon your increasing call volume, it'll automatically alleviate your burn rate. And then nowadays, you can actually have it auto order certain supplies for you once you hit a corresponding number or your trends hit a certain category. It knows, hey, we're seeing a lot more of this. for example, flu RSV season, we need to order more patient masks and more N95s to stock up beforehand so we know we don't hit that 3 month supply and get underneath that window of where we should be to be safe. Another thing a lot of people are using it for, I know one healthcare system here in New Jersey utilizes it in their dispatch center, kind of like what Maya was showing before with the different EMS call trends and where their calls are. They use the same thing, but they actually pre-stage their resources in different areas of the city based upon historical trends and weather. It pulls weather data into it as well, and it lets you know based upon previous storms or heat emergencies where the call volume was, so they know where to stage their ALS and BLS units throughout the city. So as calls come in, it shortens that response time, and they're able to answer that call a little quicker. Another big thing a lot of agencies have started to use it for is for emergency operations plans. Now, there is a big caveat to this. Like I said before, never use that final document that comes out of an AI, but it's great to get you a template or at least a starting point to create your emergency operations plans. I would never feed all the information in and let it come out as just a final product and submit that. It's great to create a template to figure out maybe little things you might be missing or to give you different ideas for your response of how it could work. The chatbots will simulate human conversation, but you really need to train your chatbot. That's the one thing a lot of people forget when they start utilizing these chatbots is they require training. I have no play in the game. I don't have anything with any of these companies. I personally have always used ChatGPT. That is just my personal one. Anything I say here can be used with any of the chat bots that are out there. I'm just very familiar with ChatGPT. I've used Claude, I've used Gemini, I've used a few of the other main ones. I prefer ChatGPT only because I've been with it since the beginning, and I've trained my chatbot very well over the last 3.5 years to where it knows how I speak, it knows what I'm looking for, and it knows the output type that I want to get from it and what the documentation I'm looking for looks like. So I'm just privy to that. Excuse me. You can do that with any of these other versions, but you need to train it. It needs to be fed good information. It needs to be taught what the output should look like, consistency, and what you're looking for when you ask it to output that documentation. And also, if you're not feeding it good information, you're not going to get a good output. Bad information designates a bad output at all times, no matter how well you train that chatbot. Utilizing it for your emergency operations plans, you can help to document and reference other incident action plans or different sections that you may have forgot, depending upon the length of your emergency operations plan. I know at my facility, it's about 200 pages. I'm not going to remember all of it, so I use it to correlate data between the two and how one response plan correlates to another and how it syncs together. You're going to have that incident report based on your input. So you can actually utilize it to reference different incidents. As you input incidents happened, you say, hey, I want to refer to this page in the EOP or this plan within my EOP. How did I do on this as a scoring aspect? And where did I deviate from the plan? And what were the failing points because I deviated from it? So that way in your after action reporting, you can document this was the failure point or this was an identified failure point. And we need to make sure we don't go through that again to see the same results. We want to see a better result next time. The biggest reason I use AI nowadays, especially for preparedness and training, is as a tabletop exercise, actually facilitator. There are multiple different AI softwares out there. The one that I'm familiar with that I've used, again, I have no play in the game. Prepper.ai is a really great resource that I've worked with Justin on. He's shown me a lot of it. I was a subscriber to it. I love their product. I have no play. I don't own any part of the company or work for them at any means. But that is specifically emergency management, emergency preparedness focused AI for creating tabletop exercises. And it does an immaculate job. It can think of scenarios that you can never think of. It'll prepare your documentation for you. And it does it to the HCEP, the Homeland Security Exercise and Evaluation Program standards, or FEP standards. They do have the Public Health Emergency Preparedness standards as an option in there as well. A cool point that is coming up with them, and I know a few others are doing it as well, is you'll be able to create that scenario with them, and then it won't give you as the facilitator all the details, so you can actually play in that exercise also. And the AI acts as your facilitator, which is great. In my department, we're small. We only have 3 people for our entire healthcare system in my emergency management team. So we don't get to play that often when we run tabletop exercises. We're usually the ones creating it and then running the exercise. And we always have to simulate, we're on vacation, we're not here, we can't be reached by phone, what are you going to do without us? But using AI and training it to run these exercises for us, it's been great because we've been able to jump into the player shoes and actually do the job that we're going to be there doing and see how we integrate with the rest of the incident management team and the organization as a whole. We have used AI for some great emergency videos, which I'm going to show you a little later on. It makes some goofy, but they are very useful emergency videos that you can utilize to set the tone of your exercises. It'll definitely help you speed up your plans and your creation of these exercises, but you always have to spend that time and read through it and put that human touch onto it. Reducing errors and ensure consistency is great, but if you start with an error and you approve an error, it'll learn from that error and it'll keep performing that error multiple times. So you need to make sure you're very stringent on reviewing that data and making sure that it's correct when it's outputted, and then clarifying with that chatbot or your AI software, hey, this identified as wrong. You don't need to fix it now, but let's not make sure this happens again. It's basically like talking with a child. So utilizing it for these tabletop exercise one for driven scenario generation is great. So many times people think of just your fires, your evacuations, active shooters, your normal exercises, emergencies that people always build upon. Using AI, we've come up with some very interesting ones that we wouldn't have thought of in the past. Some examples, you'll see the video on a little few slides. One was one of my facilities just recently got a hyperbaric chamber. And one of the scenarios we helped come up with was a simulation of a decompression incident where the chamber was decompressed not correctly, resulting in a catastrophic implosion, causing damage to the facility, leading eventually to an evacuation of the facility throughout multiple steps. This was for a full-scale exercise. And we used AI to help create the scenario, write the documentation, give us our injects of what things we're looking for. And at the same time, it was able to create a short 10-second video that when the incident started and the incident management team assembled for our full-scale exercise, they were able to see what looked like a security camera footage of the incident happening and why there's police and fire on scene, why there's smoke coming from different facilities, why people are yelling and screaming on the radio. They got that feel of, hey, I just got here, this happened, I can actually see it. Now I know what's going on. When we get into these training exercises and scenarios, I'm sure a lot of you have experienced this before. People just kind of go with the flow and they get into that normal response of, oh, this is just an exercise. I'm going to do this. I'm going to do this. We know this is going to happen. Oh, we're coming up to module 3. There's going to be a clipper or something here that's going to try to throw me off. With AI, it can catch up on people doing that, and it can throw ad hoc scenarios into your exercise that you wouldn't have even thought of as an inject and that none of your players would thought of, and it'll throw them in at different times. If your team is doing too well, you can train the AI software to throw injects in earlier and throw them off, or give them an example of another scenario that's going on with it. So now they have to divide and conquer two separate competing issues, resources or personnel, of how they're going to respond to both scenarios and maintain that differentiations of their priorities of life safety being first, and then stabilization of the incident, and then finally preservation of property and the environment. Looking into this more, a lot of these trainings with the video generation modules that are going on now, they're able to give a really good realistic training environment if you can't afford it, especially when you get into like the VR and AR stuff. That's something we're starting to implement more in our training and simulation lab. Not just for patient care models, but for disaster training. You're able to use live drawings of your facility in a VR scenario, virtual reality scenario, where it's a little cartoony and obviously it's like 3D and it's from like a video game, but they're able to go through their live facility and know, hey, this corridor leads to this, or this room is this. Go through their emergency response procedures, see where the AEDs are, where the fire extinguishers are, the pull stations. Where am I going to do if it's an active shooter? Where can I barricade doors? What does my situation actually look like in the unit I work in without causing any issues or disruptions to that live unit while patients are still on it? Something we've been looking at too is utilizing this with our security team for dealing with combative patients or emotionally disturbed persons, of how they're going to deal and de-escalate the situation using an AI model as opposed to actors or mannequins. So that way they're not in the live unit, they're in a separate area. We can grade them and assign adjustments, and we can change the scenario a little bit. So, hey, maybe you should do this. Let them rerun it through it again and see how that pathway would lead separately to what it led like the first time. Some examples of different AI software that are out there that are great for everybody. HeyGen.ai was one of the first video creation services I utilized. It's great. You can sign up for a free account. You don't have to pay for it. They give you a certain amount of tokens every month, which allows you to create like a 5-minute video every month for free. It's really good. Some of it's a little janky. You'll see in the next slide, I have one of the free videos there. And that's more for like your news media, your introduction, or your like Teams calls videos. Or if you want to have them Teams call a person that's at another facility and you don't want to actually impede on that other facility. Or if you want to throw a news reel in that's showing, hey, this just happened or it's breaking news. It's really good for that. You can set a background. It's kind of like a announcer speech. On the free version, you'll see in the video, it's a little janky. They're kind of really slow. It's a live person, but their emotions and their physical movements don't really match the scenario depending upon how you use it. If you were to get a paid account, there's different emotions you can do. There's different people. There's a whole bunch of stuff you can do, but it's a very good tool. ChatGPT, obviously, as I'm sure most of us are familiar with, great for real-time communication. You can train a chatbot to actually act as different people. I used it on our last full-scale exercise, working as the sim cell, when people would call up and say, hey, I want to talk to the Passaic County Sheriff's Department. Okay, what is it you want to ask them? Whatever they'd ask me, I'd send a message to ChatGPT trained on our scenario. Hey, they have a call from our hospital command center to Passaic County Sheriff's Department. This is their question. What would their response be? So I didn't have to think on the fly, answer as their response. It gave me what it thought their response would be at that time, and I just read off a script. Made life easier. At the same time, if they emailed, I could just copy their text as an email, send it back to them, and say, hey, here's your response from this person at this organization. It was great for 1 or 2 people working in a sim cell to handle a load of information and provide that realism, that response back to them. BotPress is one that's good for training chatbots. What I mean by that is if you have different protocols you're rolling out or a new scenario or a new policy that you want people to get trained on, you can train and create a chatbot that is only familiar with that process. They'll walk them through scenarios. They'll teach them the pros and cons of it, why we're doing it. They'll give simulations of how to use that policy and procedure. That one does cost some money. It is great if your organization wants to roll it out organization-wide. It saves on you if you're a smaller team, having to go out and train these people multiple times. You can use an AI agent, and then you go out and just do a functional exercise to ensure that they've actually acquired the skills and have completed the necessary requirements. Replica is a really good one that's out there. That's more for your mental health training and mental health responses. People actually use this to talk, and they are not able to differentiate between a human and an AI at sometimes. And it's able to give them that feeling of just getting their emotions out, talking with somebody on a live scale. And there are built-in safeguards to this as well, where if certain terms are said or certain feelings are expressed, and it feels like this person's either a threat of self-harm or threat of harming others, it'll actually escalate to a live user that'll jump in without the other person knowing to make sure that everything's okay. And if they need actual help or if they need 911 emergency services, they're able to get that information and pass it on and do that help as well to ensure that person gets the help they actually need. All of these chatbots require training. Some of them require money if you want to get the more advanced services. But the engagement that you get and the realism that they're utilized for is immensible. You just not having to spend money on supplies, mannequins, on large-scale functional or full-scale exercises. You save a lot of it utilizing these AI chatbots. By all means, I still love functionals. I still love full-scale exercises. I'm always going to say they're great and they should be done. But we all know limitations on our budgets and our time and the amount of time that it takes to get this done. Do your initial planning meeting, your midterm planning meeting, and all those other things takes time. And that's usually when you have other emergencies going on. So you can utilize these to do your functionals and your smaller scale exercises and keep that engagement going. So this next slide, these are some of the videos that I have here. The audio should translate across. I hope it does. But 3 of these videos here, it's okay if the audio doesn't. The first 2 videos don't require it. The first 2 videos are from 2 full-scale exercises we ran last year. This was using ChatGPT's video generation service, Sora 2. It unfortunately just was sunsetted by ChatGPT a few weeks ago. It believed June 1st is going to be the last day for Sora 2. This was a free video generation software that came with a paid ChatGPT account to make 10-second videos based on a prompt. These first two videos are from two full-scale exercises we did for two of our campuses last year. So this first one is simulating a helicopter crash on our helipad at our trauma center in Paterson, New Jersey. Obviously, we didn't really want to crash the state police's medevac helicopter into our helipad, so we used an AI generation software to create this video from a security camera to show the command center and the responding fire department what had occurred when they got there. I'm going to play the video. I'm going to say this is kind of that janky part where I said the AI is not great, but it still gets the idea across, and you'll see what I mean in about a second. For a free video, not bad. It was supposed to explode, not just kind of like dull into the landing pad and just kind of break apart. For the full scale exercise, after that occurred, we had smoke machines and flares actually going up on the helipad for the fire department responding to see, as well as our security cameras from the command center to see, oh my God, there's explosions of smoke going on up there, and get that feel of a live emergency going on. This second video was for our Wayne campus. This is a hyperbaric explosion I was talking, or implosion. Obviously, with these videos, a lot of them have the safeties built in, which I am 100% for, where you can't show human gore or human injury or anything like that, and I am 100% for that. So in this video, you will not see any people in the tube. You will not see anybody blown up or anything like that, but it still gets the idea across of what had happened. And it's whole different security videos throughout the hospital, leading to a structural collapse. Eventually, it led to a full-scale evacuation of the hospital. And this second scenario actually led into that first one. So the way the exercise worked, the Wayne Hospital had this implosion. There was an evacuation. One of the severely injured patients actually had to be flown from the Wayne Hospital to the Paterson Hospital because of all the emergency responders. The roadways were clogged. And that helicopter that patient was flown in was the one that crashed at that first incident. So not only did our incident management team have that to deal with, they still had the Wayne scenario going on at the same time, and it was watching them try to correlate the two sites and the emergencies going on. Finally, this excuse me, this video over here is from HeyGen.ai. Apologies. This is from one of our tabletop exercises we did. And this was a breaking news report of a scenario of an incident going on offside of the campus, leading to a patient surge at the hospital. Now, you should be able to hear the audio, but let's see. Can you hear that? No? Okay. So the audio is not working, but as you guys can see, it's basically a news break. Obviously, we're not in Miami-Dade, Florida, so we stole that footage from YouTube. We were able to put it in the background, and it was simulating of a parking garage collapse at the college that's right behind the hospital that we have in Wayne. So utilizing this was an update version going on that, hey, this had happened. Emergency responders are on scene. The news is now picking it up. What are the updates and what are the issues we're going to see with the news now catching on to this? What else are we going to have to deal with aside from patients? Well, family, large law enforcement presence, an investigation. Federal agencies will probably be involved. And this led to a great discussion of how we're going to deal with this. And utilizing AI to make these videos, this took me probably 5 minutes. And it was a great inject for them to actually get a feeling of, oh my God, this is happening right behind us. This is what the scene looks like. Because they usually don't see that. They'll just hear it from the patients coming in, or they'll hear it on the radio, or if you have the news on, they'll see whatever video they have there. So that's why this was great to get that feeling on a tabletop exercise of, oh my God, something's actually happening. A lot of the stuff we talked about already, but these ethical concerns with AI are all over the place. No matter what, data privacy is the biggest concern. I don't care if you have the highest tier ChatGPT, Claude, Gemini, any of those accounts. They are all susceptible to hacking and cyber incidents. I would never put any personally identifiable information or any confidential information into an AI software. I always recommend scrubbing data before you upload it into any AI software. And what do I mean by that? Deleting phone numbers, deleting titles. You can use organization name, that's fine, but I wouldn't upload your building plan. I wouldn't upload your entire EOP with your, CEO's cell phone number in it or anything like that, your mayor or your county coordinator's cell phone number, because no matter how safe or how secure the system might be, there are always ways to hack the system per se. I right now could go into a free ChatGPT account, and there are different terms you can utilize to get it to bypass its safety measures. I'm not going to tell you what they are or how to do that, but it'll tell you how to make a bomb. It'll tell you personal identifiable information from. I could look up if Essex County has ever put the sheriff's department, the sheriff's personal cell phone in there. There are different ways to get this information out of it and easily bypass the constraints that are built into the system if you know a little bit of coding and different terminologies to use for it. Algorithm bias is a big one, depending upon how your chatbot was trained. Obviously, you have to worry about bias. There was a huge news article for any of you that have used Twitter or X when Grok first came out. People were actually able to train it to be racist very easily within its first 2 hours. It automatically flipped around. A lot of no good people were able to get in there and train it, and every response that came back was a racist response or a racist remark. They actually had to wipe the system and pull it down for a number of days and retrain it and reauthorize the system, and had to teach it that it's only going to learn from credentialed people and not from the everyday public. And that can happen in any system. It doesn't have to be that extreme, but that was just the most public version of people are familiar with. Then with your IT departments, integrating it with your assisted systems is going to be a huge thing. Definitely have your chief information security officer on board, as well as your entire cybersecurity team at your IT department. They need to have full buy-in from this, even if they airlock it, which means putting it on a computer that is off network and it can only be accessed on site. There are still ways for it to be corrupted and for the data to be accessed, no matter how good the systems are. So you really need to have that CISO and IT cybersecurity involvement. When you're integrating an AI, you should actually have transparency in how you want to do it, what the process looks like, and who should be involved, and what your end goal is. You're always going to want to monitor its performance throughout time, not just the amount of usage, but the end state that's being put out, because there could always be small influxes that are being input into the system that could degrade the entire process and make you start over from scratch. Best practices, get a diverse team involved. Get all the people you think could possibly be involved at the highest level. You want decision makers, not just people that'll sit there to fill a spot. You want people that have input and have a say on how it's going to operate. Always test the system. Don't be afraid to pull it back if you need to. Don't be afraid to take it offline. I would never make it so dependent on my processes that if it went down, my entire system stopped. Always have backup processes for it, or have this be the backup and make your main focus still however you operate today, and utilize this just as a tool. It should never replace people. And that, I don't want to go over time. This is just some stuff going forward. I'll just leave it up on the screen, but that is going to be all I have. I believe Terry probably jumped off, so I'm waiting to see. Alfred, are you there?
Yes, Terry's still here.
Yes,
Oh, sorry,
I
I
am.
didn't know if you had to jump off.
No, I'm sorry. I was looking at a work thing, but now I am back. And I do think we only have 2 questions in the chat if folks don't have any others that they are thinking of. But first, are you using AI currently to plan for the next pandemic? And have you used it to figure out when the next pandemic might happen and what disease it might be?
Maya, would you like to go first?
Sure. I think when we looked at the GIS that we did in the mapping with the respiratory disease and the train stations, I don't know if we're planning. I think we're always planning for the next pandemic. I think we're always planning for the next emergency. But I think what we've learned from the use of GIS, the use of machine learning and AI, is that we can actually very quickly respond as to when during COVID we were not. The other thing is that we learned is that the one thing that we need to do in the beginning of an emergency, especially one that has to do with communicable disease, is start collecting data immediately. Once we start collecting that data, then the more data we have, the better chances we have of predicting what's going to happen. Just like if we were able to go ahead and start thinking, okay, let's start predicting where these cases are coming from. And all of a sudden we started seeing them around train stations, maybe predicting, maybe understanding that we could very quickly take the train travel out of it, and we could have stopped some semblance of spread in that case. And that I'm referring to this in respiratory diseases and other diseases. But I think after what everyone's been through during COVID, I think one of the things that Chris has said, and I know this is what we do in Essex County, we do drills, we partner, we talk to each other. We're constantly talking to our partners. We're constantly having conversations. And I think, are we planning for the next pandemic? Absolutely. I think that's our jobs. Because if it's not happening, right? If you're not hearing about public health, that means we're doing our jobs. But I think the thing is, yes, we're consistently planning for it. We're practicing for it, whether it's Chris practicing his emergency functional diseases, whether it's tabletops, whether it's creating scenarios that might happen. But I think from our end, we've learned that using these tools is going to give us an advantage. And again, as I said this before, this is a tool for public health. And those who, I'm going to say this, and I might be, put into some block, but if you're not using this right now in public health or emergency management, you are at a disadvantage. You are probably 10 years behind if you are not using this.
Yeah, so I mean, just to respond back also, so we are definitely not, I'm not using the same, we're using it for pandemic. Obviously, I work at a healthcare system, so it's a little different. We are utilizing it for identifying trends, especially with the upcoming World Cup that's going to be in our area. We're going to have the final and all the people that are coming. We're definitely utilizing it within the PCR system, looking for keywords, looking for different trends of what might be going on, especially with the amount of non-certified food trucks that'll probably be in the area and food vendors that'll probably be popping up in the area. Definitely want to keep a track on that. There has been discussion. I know the state is using their system as well to monitor like urgent cares and public health awareness and hospitals and trends like that. Definitely it's an AI of some sort. It's more of a data collection as opposed to predictive analysis. But definitely there are different terms that are going to be coming out for it, and we'll see more and more advancement once the World Cup is over. We're all focused on that right now.
And then kind of a follow-up question on that is, what is the next pandemic that you are planning for, thinking of?
So right now, specifically, what we're looking at is we actually just ran some mystery patient drills. We were focusing on avian flu. That was our big one because that's a huge outbreak right now in New Jersey. And also, we're looking at the favorite thing that everybody likes to talk about because it comes up every year and a half, 2 years, Ebola, Lassa, all those outbreaks that are coming out from the Congo, especially with the international travel that's coming up with the World Cup. That's always a huge concern. I can't speak to Maya, obviously, on the public health side, the hospital. Those are my priorities, like communicable disease wise, what I'm looking at. But I'll turn it over to her.
So I just want to make two distinctions. So when we talk about the word pandemic, we're talking worldwide, right? So that's a pandemic. And then I think right now, seeing something, and if I just want to make that very clear. A pandemic is a worldwide. And from our perspective, if that's the wording that we're using, I think that public health is looking at measles. I think that's where we're looking at. And I think that is where our preparedness is going, because measles being one of the most contagious diseases in this world. And if we're looking at the word pandemic, that's what we're looking at.
Another question, how can an IT beginner start as far as securing home computers and devices, and any resources to learn more about AI?
So I'm going to take this one, I assume, because Maya's not the IT person. So a lot of good stuff for IT. Really, the best thing I could recommend are the free courses on like Coursera or the Google Course Library. They'll give you a lot of basic understandings for IT and how you're going to implement AI. As far as your home network, things I always recommend and that I do, I'm an IT nerd. I have my own home network built out. I'm not going to worry about teaching you guys about like DHCP, setting up blockers, how to do all this really techie stuff. You'll learn that the more in your field. I would recommend always reading articles, starting with a basic. There's a basic certificate from CompTIA called Sec Plus or Security Plus. The test is very hard. I'm not going to lie to you, but the information you gain and the training that you get just doing the course will give you a lot of information just for preparing your own home. I always recommend a home firewall. I do work or have a smart home. A lot of tech people don't like that nowadays. I personally do, but I've put firewalls and security measures in place so that I'm not worried about my data being leaked. That things you'll learn though the more and more you do it. I am not a trained or college educated tech person. I learned it all just from doing it in the field.
Awesome. And then Maya, I think this question came in during your presentation. When you say bait for the rodents, do you mean bait boxes which use rodenticides?
So there are different ones. Most of those, so rodenticides kill rodents, but there's different ways. There's like warfarin, so that there's different components. So for those particular bait boxes, I can't quote exactly what the pest control company was using, but I will say that the AI allowed us to create a completely chemical and pesticide free pest control program without having to use any bait boxes.
Given the defunding of public health in parts of the US, how can we and other people help to rebuild and support these systems?
By participating in programs like this.
Joining us tonight.
I'm going to say that public health is I think public health is changing. And I think if you don't see that it's changing based on this conversation, it's changing to create a world that's going to make life a lot safer because of the technology that we're implementing. And I said this before, if you're not advancing and using these tools, how would you want to know why wouldn't you want to know what your exact town looks like and what the flu season is going to look like within your municipality? You're not looking at worldwide trends anymore. You're going local. And that's what public health is. It's becoming extraordinarily hyper local. It's becoming a much better and data driven science. Public health back, I'm not going to date me, but it used to be pamphlets, flyers, and health fairs. That's not what public health is anymore. Public health is emergency preparedness drills. It's data-based, evidence-based. It has science behind it. And I think to push the fact that public health is a science is really the case that we should be making for public health.
I have nothing to add on that. She said it all.
Agreed. What data and sources are you reviewing for measles?
From our end, what we're doing is we're looking at vaccination rates. So the vaccination rates that we're using, and they're kind of scary. So in the state of New Jersey, we do school audits, right? So we have mandates for school attendance and vaccines. So we're looking at the vaccination rates in children. We're looking at religious exemption rates that are coming in. And we're also looking at vaccination rates just in general with just in general with just the population. And if any of you have read any articles recently, we have lost our herd immunity in measles. So we are definitely on an upward trajectory of seeing that measles outbreak.
And then I think this is the last question that I see on my end, and a pretty interesting one to end it on. Are you afraid that employees and other public health professionals will replace critical thinking with AI?
I'm going to let Chris answer that one first.
So, shorter answer, yes, but not in the way you're thinking of. I think typical statement from, I'm not the oldest guy, but I'm up there now. The younger generation obviously has a much heavier focus on AI. I don't think they're going to lose critical thinking, but I think they are going to lose the ability to differentiate very easily both the younger generation and the very old generation of what is real and what is AI generated. We're already seeing it a lot nowadays. And AI, as it advances more and more, the capabilities out there to not be able to distinguish as easily as it is today between what's AI and what's not are going to diminish severely. I'm usually pretty good at spotting AI photos or videos or stuff like that my wife or my mother-in-law always get caught up on. They're like, "Oh, we're going to donate to this." I'm like, "No, that's AI. Stop that." Like, but the more it gets and some of the progress I'm seeing, I'm going to see that it's going to blur that line very, very well. I don't think it's going to replace critical thinking, but I think it's going to make life harder, and the disinformation campaign is going to get more and more. Disinformation is going to be the bigger problem that we have to deal with as opposed to the loss of critical thinking.
So I think from a public health professional perspective, and I say so, I'm also an adjunct professor. I teach both the master's public health law class and an intro to public health, so two very separate components. And what I do tell my students is that AI is here to stay. If you're in public health, you need to understand that there's a big public facing component here. So if you're not ready to face the public and have conversations and be out and start to think about what policy looks like and create that type of world, as far as, implementing a program or using data to create a program, do I think AI is going to make that a lot easier for us? Absolutely. I think taking data, creating that programming, but I think implementing that programming is where the public health professionals, I think, are going to be the public health professionals. Because standing and speaking to someone and giving them a human component is not going to be something that AI is going to replace. And I say this all the time. I can use the data, create the program, but I can't create the community. So that's really where we're going to be, I think, still around as far as AI is concerned.
Awesome. Well, I think that is all of the questions and things we had. So Chris, Maya, thank you so much for joining today and volunteering your time and speaking with us, and happy Public Health Week to everyone. Al, anything else before we jump off? Awesome. Thank you again for joining. Really appreciate it.
Public Health Week, everyone.
Thank you very much.
Thank you all.
Bye.
Bye.